Hello juniors, so I welcome you all again in the continued series of general anatomy, and today we are going to cover a topic which is generally not asked in any exams or vivas but will surely help you throughout your medical career. I think this topic is a prerequisite to thorough understanding of anatomy and understanding further higher subjects like radiology and surgery. So you must have great command over this topic. So without wasting any further time, let's move ahead. So basic question arises that, sir, why there is a need of planes and section in understanding anatomy, which is not in the subjects like physics, chemistry, biotech, and all that. So this is a bit obvious and should make sense to you that we are viewing human body externally and its only outer surface. So to get to know what's the real stuff going inside, we have to cut open or make sections of the body in various planes. And this is like same as what our mothers do every day. So viewing a vegetable from outside does not ensure its edible quality. To view the inside stuff quality, she dissects the veggie, ensures the quality, and then she cooks. So this is the nice segue to start with the topic planes and section. And planes and used to describe location of internal structures and used to describe orientation of structures. So if you ever think once in a while that what happened if our old age anatomists never did dissection of human body, they throughout the life studied the external of human body and its what is visible outside. So up till now we would have not known the exact location of our heart, our bladder, our brain. So there comes the importance of planes and section in understanding the anatomy. So coming to the terminology that what does planes means? Planes are the axis. You must have already covered this in your physics and chemistry classes that if this is the y-axis, this is the x-axis and this is the z-axis. So these are also axis and plane corresponds to this axis. So if I draw this once again, this is x-axis, this is y, and this is z-axis. And if I plot the human body along this axis, so for surely my y-axis and minus y-axis will correspond to the height of that person. My z-axis and minus z-axis will correspond to the anterior and posterior measurement of the person, and my x and minus x-axis will correspond to the right and left dimension of the person. And when the body is sliced along these planes or axis, the slice of the body when is made in a particular plane, that slice is called section. That slice of body is called. So now starting with the types of planes. So there are basically three types of planes, and I'll explain them one by one with the help of analogy of this fruit apple. So starting the mainly there are three types of planes and their section and their related sections that I have already told you. Planes are the axis and sections are the slices of body that are made corresponding to that axis. So our first plane is sagittal plane. This plane divides the body into the left and right half. You have to remember the left and right half. This plane divides the body into left and right half. So for example, this is an apple, and if this apple was not cut into half, and if this apple was totally integrated, so this if this is the eyes of the apple, and somewhat like this apple would have been. But now since we have sliced the apples into half, so this is the one half of the apple and this is the another half of the apple. So basically this plane, the plane along which the apple is divided, this plane has divided the apple into the right and the left half. So if this is the left half, this is the right half. So this plane, the sagittal plane, has divided the body, or we can say apple, into left and right half. Similarly, mid sagittal plane divides the body equally into left and right half. I'll show you this in a minute. So if this is the apple cut from right in between, that plane would be the mid sagittal plane. So for example, this is a letter S. If this is divided along this plane, this is the left side, this is the right side, and if I cut this letter from the mid, and where left side is equals to right side, this plane would be the mid sagittal plane. So coming to our original example of human body, what we are practicing for. So if this is the integrated single piece person, and I have made a plane, I have decided a plane to cut the body in that plane and obtain a section. So if I passed a plane like this and I decided to slice the body, what I obtain is the right hand side of the person and the left hand side of the person. And if I equally divide this, if I pass the plane along the center line, what I'll be able to get is the right hand side will be equal to the left hand side. Here I haven't shown you the left hand side. So basically, as I've told you, our end goal of sectioning the human body is to view the internal organs. And if I section this body right here, there is no use of sectioning the body until and unless I am unable to view the internal organs. So what I have to do is, if I am standing in front of this person and sectioned this, I have to remove one or the another part. So suppose if I have removed this left part, if I have removed this, and if I turn around 90-degree and view the remaining right half from this angle, what I'll able to get is something like this. So as I have already told you, if I was standing right in front and if I go diagonally, so up to some angles, then what I'll be able to see is a person like this. And if I turn around by 90-degree, what I'll able to see is a person sliced into half. So this is the right half of the person, and to view the right half of the person, I have removed the left half of the person. I hope you are able to get the point, and the big picture and the crux line is that we are slicing the body to view the internal organs, and to view the internal organs we have to make some angle changes in our point of view to view the sliced section of the body. Coming to the coronal type of plane. So this plane divides the body into front and back. So again, with the help of the analogy, if this was the back of the apple and this was the front of the apple, I have cut this apple in such a plane that we have separated the front part and we have separated the back part of the apple. And in reference to the human body, a plane is chosen such that it divides the body into anterior and posterior part. So once again, this is the one single integrated person, and I have chosen such a plane that it divides the body into anterior half and posterior half. This is the anterior half and this is the posterior half. Suppose I have made a cut along the edge, but what's the point of this plane? What's the point of dissecting this if I am not able to view the internal structures? So what I have to do is I have to split the anterior part and posterior part away from each other, and I have to change my angle of point of view. So if I am standing right here, means the point of view which you are able to see right here, there would be no sense of sectioning the body if I am not able to see the understructures. So I have to go backward or I have to go in front to view the sliced organs. So if I wanted to see the anterior part, so if I have made a plane and cut the body along this plane, and if I wanted to see the anterior parts, what I'll do, I'll remove this posterior part, I'll remove this, I'll change my angle of point of view, and what I'll get to see about the anterior part is something like this right here. So in upper diagram, my point of view was from the lateral side. Now in this diagram, my point of view is from posterior. I am viewing this body from posterior side to assess the sliced organs, and this is the anterior part. What I have, this is once again the lateral view, and this is the same for the posterior section as well. And once again we cut this, we remove the anterior part. This is the anterior part. We remove the anterior part, we go in front of the person, the sliced person, and what we are able to see is this posterior part. This is the posterior part we are able to see by moving anteriorly. So this was the posterior part. So I am viewing from here. So in this diagram, you are not able to see the slice structures because of a wrong point of view. But if my point of view changes to the anterior, I would be able to see what is shown right here in this diagram. Coming to the last plane or last type of section, so that is transverse plane, or also known as axial plane. So this plane divides the body into superior and inferior half. So I have again taken analogy of an apple. So this is the superior half, right here is the superior half, and this is the inferior half of the body. Once again practicing over our united person, wholeheartedly united. So this was our united person. If I wanted to divide this person into superior and inferior half, what I'll do is I'll take such a plane that and cut this into half, that a body is divided into superior part and rest into inferior part. So what I have told you, I have made you shown right here. So this is the superior part, this is the inferior part. So once again, the big picture is that we have to see the internal organs. I have made the section, I have chosen a correct plane, but what's the use if I am unable to see the internal organs? So I'll change my point of view. So once I'll change my point of view, if I'm standing in front of this person, I'll go beneath this person and watch the sliced organs. So here is the point of view that would be able to help me to view the sliced organs and sliced body structures. So up till now it was all about the all three types of planes and sections into which the body is sliced. Now I have a short exercise for you, and these are the diagrams which I have used in my videos on anatomy, and we'll perform this exercise and try to find out from which plane or from which type of section that depicted diagram is from. So starting with our first type of diagram, the first one is that you are able to view the heart, the full heart, both the lungs, this is the ribs, and what you can see that the body is not divided into right and left. The body is not divided into superior and inferior. This is superior and this is inferior. Body is not divided such that so the last option we get is that body is divided into anterior and posterior. Something is missing from the anterior, so I'll depict that for your better understanding. If this was a person, right here would be the nipples of the person, and the anterior portion is dissected out and we are able to see the posterior portion. Obviously, to make the relevant topic easier, they have not shown the diagram of hands and all that, but now for our point of view, we are only able to see the posterior structures of the thorax. So therefore this type of section is coronal section. Coming to a second example, you are able to view the anterior and posterior. And remember, we have changed our point of view from in front to from the lateral side. And there is no division into superior and inferior. The body is divided into right half and left half. And you are able to view the right half of the body. So therefore, this type of plane is our sagittal plane and the body is sliced into the sagittal section. This is another example. So these are the bones of the foot that forms the arch of the foot, and you are able to view that the bones are dissected such that you are able to view the posterior half of the bones. You can appreciate that anterior half is missing. So we have chosen such a plane that the posterior half is visible and not the anterior half. Therefore, this is also a coronal type of plane. Coming to the fourth example, this is once again the posterior and anterior side. Body is not divided into superior and inferior, and therefore this is the sagittal type of plane. And the last one is this. What you are able to view is the anterior. This is the sternum right here. This is the anterior portion. This is the posterior where you are able to see the vertebrae. These are the lungs, and in the center we have the heart. So what you are able to see that body is not cut along the midline, so that body is divided into right and left. Body is not divided into right and left, and body is not also divided into anterior and posterior. So if here was a line through which the body is divided into anterior and posterior, and certainly here there is no plane that divides the body into anterior and posterior. What we are left with is the third type of plane, that is the axial or transverse plane, where the body is divided into superior and inferior. So if you are able to understand this, well and good, but if you are not, I have a better trick for you. So if this is the superior half of the body, suppose this is the superior half of the body, and right here is the person lying on the bed, and you are the doctor right here, and you are standing at the legs of the person, at the leg side of the person, and assume that the half of the body of this person has been removed. And what you will be able to see is that if half of the body is removed, this would be your point of view. You would be able to see that what you would be able to see that this is the chest, these are both the lungs, and this is the vertebra, if the inferior portion of this person has been removed. Now coming for the clinical relevance of the topic. As in every video, I clinically correlate the topic, and this topic is already a clinical topic, but still from summary point of view, clinical relevance of this topic. So medical imaging interpretation. So knowledge of anatomical planes, what I have covered, that sagittal, coronal and transverse, help in accurately interpreting the CT scans, MRIs and X-rays. Surgical precisions. So surgeons rely on anatomical planes to make precise incisions. So if you ever attended your clinical rotations in surgery postings or going to attend in surgery posting, what you will see that surgeons will quickly go through the planes and will analyze pre-hand the safety of surrounding tissue and all the necessary things which are required for successful operation. Physical examination and diagnosis. So physicians use anatomical plane to describe location of pain, injuries, abnormalities, improving communication and clinical assessment. So if Dr. A wants to communicate about the disease or about the injury to Dr. B, he would be communicating in the language of planes and sections. Lastly, the pathology and injury assessment. So pathology and injury assessment is the understanding sections help in identifying the extent of injury. So if a patient is present in an OPD with the fracture of humerus, so understanding or knowledge of planes and section would easily help to recognize the the extent of injury and would help in planning appropriate treatment. So lastly, this is the CT scan of chest and you are able to view the axial plane. The section is made in the axial plane. So this is the MRI section of brain and the plane is the sagittal plane, because you are able to see the anterior, posterior, and you have changed your point of view from anterior to the lateral side to view the sliced section of the body. And lastly, this is the coronal plane, where the body is divided into anterior half and posterior half. So if you found this video helpful, do like it and do share it with your friends.